Do you bleed so much during your period that you plan your life around bleeding, or wake up at night because you are soaked through pads or clothes? Heavy periods are not something you should just manage, and today I will tell you why. Heavy periods are extremely common, but they are often ignored, normalized, or misunderstood. Many women are told it is just your body or that is normal after childbirth. But the truth is, heavy periods are a medical condition, and sometimes they are signs that something deeper is going on. What is heavy period? A heavy period medically is called menorrhagia. It is more than just a lot of blood. You may have heavy period if you bleed for more than 7 days, which may lead to weakness or dizziness during your periods. If your period is affecting your daily life, it is not normal. What are the common causes of heavy period? Number one is hormonal imbalance. Hormone controls your menstrual cycle. When estrogen is too high or progesterone is too low, the uterine lining becomes too thick, leading to heavy bleeding. This is common with teenagers, women approaching menopause, or women with PCOS. Number two is uterine fibroid. Fibroids are non-cancerous growth in the uterus, and they can cause heavy bleeding, long periods, clots, or pelvic pressure or pain. Fibroids are one of the most common causes of heavy bleeding, especially in women in their 30s and 40s. Number three is adenomyosis. This happens when the uterine lining grows into the muscle wall of the uterus. Patients may experience heavy and painful periods, swollen or tender lower abdomen, period pain that gets worse with age. Number four is endometriosis. Endometriosis doesn't always cause heavy period, but when it does, periods can be very painful and unpredictable. You may notice severe cramping, heavy bleeding, pain during sex, or infertility issues. Number five is intrauterine devices, IUD. Copper IUDs, especially in the first few months, can cause heavier bleeding, longer periods, more cramping, and this usually improves over time. But if it doesn't, it needs evaluation. Number six is blood or bleeding disorder. Some women naturally have conditions that affect blood clotting, such as von Willebrand disease, which can lead to extremely heavy periods. And here come the last, pregnancy-related problems like miscarriage or ectopic pregnancy. If bleeding is heavy and unexpected, always seek urgent medical care. Symptoms of heavy period you should not ignore. Heavy period doesn't just affect your cycle, it affects your whole body. Watch out for extreme fatigue, shortness of breath, dizziness or fainting, pale skin, headaches, and low energy. This can be sign of iron deficiency anemia, which is more common in women with heavy periods. When should you worry? You should see a doctor if you bleed through pads every hour, your period lasts longer than 7 days, you pass large clots regularly, you feel weak, dizzy, or breathless, bleeding interferes with your works or sleep, or heavy period suddenly starts after a normal period. Painful and heavy periods are not a badge of strength. How are heavy periods diagnosed? Your doctor may recommend blood tests, ultrasound scan, pelvic exam, and hormonal tests. Getting diagnosis is the first step to relief. Now let's talk of treatment options. Treatment depends on the cause, and it may include hormonal therapy, non-hormonal therapy, iron supplements, procedure for fibroids, or surgery in severe cases. You don't have to suffer in silence. Heavy periods are common, but they are not normal if they disrupt your life or affect your health. Listening to your body is not overreacting. Seeking help is not weakness. And managing heavy periods can change the quality of your life completely. If this video helped you to understand heavy periods better, like, share with another woman, and subscribe for more health content. Comment below, do you struggle with heavy periods? You are not alone. See you in my next video. Bye.